going to cover chapter 22, infectious diseases affecting the gastrointestinal tract. We're going to be able to draw. Did you know that drawing is one of the best ways to learn something? Draw or describe the anatomical features of the gastrointestinal tract and list the natural defenses. There are 8 main segments in the gastrointestinal tract: the mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, and anus. There are 4 accessory organs: salivary glands, liver, gallbladder, and pancreas. We have defenses against a heavy load of microorganisms. So unlike the cardiovascular or the lymph or the nervous system that have no normal biota, there is a heavy load of microorganisms in the gastrointestinal tract. We have a layer of mucus, secretory IgA. Peristalsis keeps microbes moving. What is peristalsis? How do you know when your bowels have to move? How do you know? Somebody please tell me, what is peristalsis? You don't feel something moving in your stomach when it's time to go? Somebody look it up. You got something open, your phone, anything, your computer. PERI. Peristalsis keeps microbes moving.
The involuntary constriction and relaxation of the muscles of the intestine or of another canal.
The involuntary, she said.
Creating wave-like movements that push the contents of the canal.
Okay. So now do you know what that is? Involuntary movement. A wave-like motion that pushes it from the where to where? In the small intestines, pushes it on down to your large intestines, then out of the, what's next? Rectum or anus? Rectum, yeah. Okay. So peristalsis not only keeps your feces moving, it keeps microbes moving. Microbes move with it. Saliva, lysozyme, and lactoferrin in your stomach. Your stomach has an extremely low pH. And bile, B-I-L-E, is antimicrobial. What's the difference in B-I-L-E and B-O-W-E-L? Bile and bowel. You don't want to tell me that? Okay, tell me this. What is gout? Remember we talked about gout, malt? Say it. Say it. Somebody, gout. I can hardly hear you. Sometimes you can talk loudly, and sometimes you talk softly. The mouth is one of the 8 sections of the gastrointestinal system. True or false? False, you say? I heard somebody say false. What are the 8 main segments? Mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, anus. So number 1 is what? True. The 4 accessory organs are, what are the 4 accessory organs? Say it, ma'am. All right, pancreas. Pancreas is so important. All of it's important, but you get pancreatic cancer, you got something on your hands. IgG is a protective antibody found in the gastrointestinal system. That was IG what? What is this asking you? Okay. So is it true or false? Saliva contains what and what, which are both antibacterial? And lactoferrin. So the normal biota of the gastrointestinal tract is what we're going to talk about now. The Human Microbiome Project is microbial composition varies between individuals. In our oral cavity, there are 600 species of bacteria. That's a lot of bacteria in your mouth. You can gargle with Listerine. You can gurgle it. You can gargle it. I had a teacher one time. I'm not going to say why she did this, but she swallowed it. What does swallowing Listerine do for you? It does. What if you had a little nip before you came to class? But Listerine and other mouthwashes kill what percent of the germs? 99.9. So can you ever get all bacteria out of your mouth? If you'd like to see it under the microscope, you can just take a toothpick. This is a one of the lab exercises in Biology 101 and 103. Scrape the side of your jaw on the inside. Put it on a slide, a little water. Put a cover slip over it. Put it under the microscope, and you can see something moving. If you don't believe it, we can try it out. I know you're not tired of lab. You want to do some more lab? No? You don't want to do any more lab? 15 was enough for you? I want you to get your money's worth. Okay. Tuition went up, didn't it? So I need you to get your money's worth. Anybody want to try that? Just let me know. We can do it today. N-O. So in the oral cavity, there are 600 species of bacteria. In the esophagus and stomach, there are 200 species of organisms. In the large intestine, 10 to the 11th power. How many zeros is that? Microbes per grams of contents. And in our accessory organs, it's free of resident microorganisms. Does that say that there are no transient organisms? No, there can be transient organisms. Functions of normal gut biota, they serve a protective function. They teach the immune system to react properly to microbial antigens. What's an antigen? Any molecule that solicits a what? Or elicits? What is an antigen? An immune response. If it gets an immune response, any molecule that elicits an immune response. So the normal biota also aid digestion and provide nutrients. And a diverse gut microbiome is associated with health. So the defenses in the oral cavity are saliva, lysozyme, tonsils, adenoids. In the rest of the GI tract, the defenses are gout, gut-associated, what? LT, G-A-L-T. I told you the gut-associated part, so what's the rest of gout? G-A-L-T. You're not talking to me today? It's okay. Lymphoid tissue, Peyer's patches. Sig A, and rich normal biota. Those are the defenses. And the normal biota in the esophagus and stomach is Streptococcus, Staphylococcus, Clostridium, Bacillus. In the large intestine, Bacteroides, Fusobacterium, Bifidobacterium, Clostridium, Streptococcus, Hepatostreptococcus, Lactobacillus, Escherichia, and Enterobacter, Candida, and Protozoa. Candida is a what kind of infection? Yeast. All right, the oral cavity is free of microorganisms. True, false? The stomach and esophagus are free of microorganisms. The accessory organs are free of microorganisms. It is healthier to have 10 species of bacteria colonizing the gastrointestinal tract than 100 species. False. All right, let's talk about dental caries. And as I go through this one, I'm going to tell you those that are on the quiz. How about that? The most infectious disease of human beings, dental caries. Dissolution of the tooth surface due to metabolic action of bacteria results in minor to complete disruption of enamel. Streptococcus mutans and Streptococcus sabrinus are the main causes. So if you were asked to list the microorganisms in tooth decay, involved in tooth decay, and discuss the sequence of events leading to the development of periodontitis. What is periodontitis? Huh? Gum disease. All right, so keep in mind, what are those two main causes of dental caries? What are they? Streptococcus mutans, would you say it? Streptococcus mutans and Streptococcus sabrinus. Now on the final, if you see a true false that says the two main organisms involved in tooth decay are Streptococcus mutans and Staphylococcus sabrinus. It's false. Let's look at it again. I just said Streptococcus mutans and Streptococcus sabrinus. So if you see one that says Streptococcus mutans and Staphylococcus sabrinus, is it true or false? False. We got it. But we're not to the final yet. We're just working on 18 to 23. And it says list the microorganisms involved in tooth decay. Incidence varies according to carbohydrate consumption, oral hygiene, and genetic factors. So the incidence of dental caries. Here is the cusp, the surface of your tooth. Then beneath that we have what? Dentin. After your enamel, dentin. Gingival crevice. This is where bacteria get down in between your tooth and the gum right next to it. Gingiva is the gum. We have a pulp cavity, blood vessels and nerves, bone socket. Then way down here, has anyone ever had a root canal? Did that hurt? Did it hurt when it came back to life? It didn't. Well, I need to go to your dentist. You felt no pain with a root canal. Good for you. Everybody needs to get her dentist name. I have a real good dentist. He has very good bedside manner. But when that pain started coming. So the stages in plaque development and carcinogenesis. Karyogenesis. Karyogenesis. Pronounce it how you like. We have pellicle formation. Then there is an initial colonization by bacteria and plaque formation. You see all these little purple ones here? That's the streptococci. We have lactobacilli. And we have spirochetes. Spirochetes are which of the three morphologies that we studied? Spirilla. And we have Fusobacterium. Look at the Fusobacterium. What is it? Morphology. What is its morphology? Look at it. Huh? You see the little pink one at the top? Like what? Rod. A rod. Okay. Same as bacilli. And then after the initial colonization by the bacteria and plaque formation, we have acid formation and caries development. There is the acid pictured in here is green. Macroscopic and microscopic appearance of plaque. You see all these little white, how it appears right there, right around your gum. Do you brush your teeth really, really well? Do you use floss? And here is how it looks under the microscope. So the causative organisms. Look again at that same question. What are the two main causative organisms for tooth dental caries? Say it out loud, please. Yes. Will you forget that next Tuesday? You will? Well, it's just no hope for you. Common modes of transmission are direct contact, virulence factors, adhesion and production. Prevention. What is the prevention for this? Good oral hygiene, fluoride supplementation. Do you have fluoride in your toothpaste? Do we have fluoride in the water we use to rinse out with? And the treatment is the removal of the diseased tooth material. Epidemiological features. I wish this thing would be in my way. Globally, 60 to 90% prevalent in school-age children. Ooh, look at this person's teeth. When is the last time they brushed their teeth? Ladies, have you ever had a man to come up to you and want to kiss you with a mouth look like that? You wouldn't be bothered with him, would you? Huh? What about the fellas? Have you ever, what's the question? Have you ever had a lady that want to kiss you with a mouth look like that? Is that the question? What's the question? Oh, you didn't want me to go to one gender. Okay. I don't care if it's a man or if it's a woman. If your mouth looks like this, I don't even want you to talk to me. Swelling, loss of normal contour, patches of redness, and increased bleeding, spaces or pockets develop between the tooth and the gingiva. The disease extends into the periodontal membrane and cementum. Deeper involvement increases the size of the pockets, causes bone resorption and tooth loss. The stages in tissue infection, gingivitis, and periodontitis. So now what was the second part of that? Discuss the sequence of events leading to the development of periodontitis. Normal non-disease state of both gingiva and bone. Then we have a calculus buildup and early gingivitis. Then we have late stage periodontitis with tissue destruction, deep pocket formation, loosening of teeth, and bone loss. Necrotizing ulcerative gingivitis and periodontitis are commonly referred to as trench mouth, reflecting the poor dental health of soldiers in World War I. Did the soldiers out there fighting the war, were they able to brush their teeth all the time? Do dental floss after they ate their rations? Synergistic infections involving Treponema vincenti, Prevotella intermedia, and Fusobacterium species. You have severe pain, bleeding, pseudomembrane formation, and necrosis. So in periodontal disease, the best prevention is good oral hygiene. Mumps, signs and symptoms. You have fever, nasal discharge, muscle pain, and malaise. Inflammation of the salivary glands, producing gopher-like swelling of cheeks, can invade other organs, testes, ovaries, thyroid gland, pancreas, meninges, heart, and kidney. 20 to 30% of young adult males, I'm not just going to one gender, I'm just reading right out of McGraw-Hill, okay? 20 to 30% of young adult males, the virus localizes in the epididymis and testes. Where is the epididymis, mister? Under your arm. You don't mean that. But it does not cause sterility. And it's prevented by, mumps is prevented by the MMR vaccine. And we know MMR to mean what? Measles, mumps, and rubella. The effects of paramyoviruses here is what's shown. Let's see, maybe I can put it way up there. Causative organism for mumps is the mumps virus, genus Paramyxovirus. Gastritis and gastric ulcers. You've heard of people having ulcers in their stomachs, right? And ulcers other places. You can have an ulcer in your mouth. But gastritis is a sharp or burning pain emanating from the abdomen. Gastric or peptic ulcers are lesions in the mucosa of the stomach or uppermost portion of the small intestine. The causative agent, Helicobacter pylori. It infects 1/2 of the world's population, usually treated with tetracycline plus metronidazole. What else is metronidazole good for? Yeast infection. Common modes of transmission of Helicobacter pylori. There's a question mark there. No prevention. The infection in the United States rates at 35% of adults, and internationally it affects 50%. Then we can have acute diarrhea with or without vomiting. When you have diarrhea, do you have vomiting? Me either. But some people do. Diarrhea is defined as 3 or more loose stools in a 24-hour period. In the United States, the average of 1.2 to 1.9 cases per person per year. 1/3 is transmitted by contaminated food. Do you trust the lettuce when you go out to eat and eat a salad at a restaurant? I eat it. There was a time when I didn't, when it was so much talk about, what's the common microbe on lettuce? What? Sometimes what would happen if lettuce or greens were grown right next to a field where there are cows and the cows are letting their feces out, and the water runs off of that field right on over to where the lettuce is being grown. It's contaminated, and you don't want to eat that lettuce, son. And so if you think it's helping it to grow, you get your great big old head of lettuce and eat some of that. Because it grew big. You like them to grow big, right? Here's a food safety progress report for 2014. Here are all these. Look at E. coli. There's a 32% decrease in 0157 E. coli. And that's a good thing. See the smiley face here? There's a 52% increase in Vibrio, sad face. And there's a decrease in Yersinia. Salmonella. HO and K antigens are used to identify gram-positive, gram-negative enterics. H, flagellar antigen, K, capsular antigen, and O, cell wall antigen. Ferments glucose with acid and gas production. What is bad breath? There's a commercial on TV right now about what bad breath is. It is nothing but what? Sulfur gas. See, you thought somebody had bad breath just because they what? Didn't brush their teeth. It grows readily on lab media and survive inhospitable environments. Signs and symptoms of salmonella. 1.2 million cases and 500 deaths a year due to salmonella. Enteric fever or gastroenteritis can range from mild diarrhea to fever and septicemia. Typhoid fever, progressive invasive infection that eventually leads to septicemia, characterized by fever, diarrhea, and abdominal pain. It has the ability to cause disease, is independent on its ability to adhere to gut mucosa, and has a high ID50. So what are some ways we can get salmonella? Cross-contamination. How about you got raw chicken up on your counter, and you don't clean that counter really well with bleach before you put another food up there? There is a chance that you could get salmonella, especially if the chicken been sitting out a long time. Shigella. Some person in here has shigellosis as your disease that you are studying for morbidity and mortality. Shigella is a gram-negative straight rod. It's non-modal and non-endospore forming. Shigella dysenteriae is the most severe form. Frequent watery stools, fever, intense abdominal pain. You taking my picture? Oh, you want the picture of that? Okay, good. You should have told me you were taking my picture. I would have done something different. What would I? Dressed up? Yeah, that's a good answer, man. I like your answer. I was thinking something else, but I like your answer better. Take many of them you want to. You can come sit right up front here if you want to. All right. With Shigella, the dysentery is diarrhea that contains blood. Shiga toxin is responsible for more serious damage to the intestine as well as systemic effects. The appearance of the large intestinal mucosa in Shigella dysentery. Here's a normal GI tract, and here is the Shigella effects. Shiga toxin producing E. coli. Oh, no, come on. E. coli 0157H7. Symptoms range from mild gastroenteritis to fever with bloody diarrhea. It is hemolytic uremic syndrome. Severe hemolytic anemia that can cause kidney damage and failure. Toxins identical to Shiga toxins produced by Shigella. Transmission through the ingestion of undercooked beef and other contaminated foods and beverages. Is it just undercooked beef? How about undercooked pork? You like your pork chops pink in the middle? You like your beef pink in the middle? Well done, me too. Okay, well, you try that out. Keep on. Okay. I mean, of course, people who, I've been in restaurants, high-class restaurants, where even the chef will wonder about you if you want it well done. My husband says he likes a little burn on it. Really? If you paying $30 for a big, nice ribeye, or you don't want it burned, but I don't want it red in the middle. Okay, we have other E. coli. Enterotoxigenic E. coli, traveler's diarrhea, watery diarrhea, low-grade fever, nausea, and vomiting. Enteroinvasive E. coli is bacillary dysentery, blood and mucus in the stool, more common in developing countries. Enteropathogenic E. coli, profuse watery diarrhea. Enteroaggregative E. coli causes chronic diarrhea in young children. Diffusely adherent E. coli, typically associated with the development of urinary tract infections. So somebody earlier said that E. coli could cause urinary tract infections. Here it is right here. In addition to acute diarrhea in the developing world. Campylobacter. It is the most common cause of bacterial diarrhea in the United States. It's a slender, curved, or spiral gram-negative bacteria with polar flagella. Clostridium difficile, gram-positive, endospore-forming rod found as normal biota of the intestine. So, is there normal biota in the intestine? Yes. How many different species? Hundreds. The treatment is withdrawal of antibiotics, replacement of fluids, metronidazole, and a fecal transplant. A fecal transplant? What's that? Colon. This is how your colon looks in Clostridium difficile infection. Vibrio cholerae is a comma-shaped rod with single polar flagellum, vomiting copious watery feces, rice water stool. Causes hypotension, not hypertension. What's high blood pressure? Hypertension. This causes hypotension, tachycardia, cyanosis, and shock. It has a 55 to 70% mortality rate. The transmission and epidemiology: warm, monsoon, alkaline, and saline conditions favor growth of Vibrio. Cryptosporidium is an intestinal apicomplexan protozoan, hardy intestinal oocyst as well as a tissue phase, penetrates intestinal cell walls and lives intracellularly. Oocysts are highly infectious and resistant to chlorine. Symptoms are headache, sweating, vomiting, severe abdominal cramps, and diarrhea. That's what it looks like. Here's on the right-hand side, there's a micrograph of Cryptosporidium merozoites penetrating the intestinal mucosa. And in this other one, this is the green that's on top here of the mucosa is attached to the intestinal epithelium. Rotavirus. Where do you think rotavirus comes from? It's a double-stranded RNA genome with both an inner and outer capsid. Primary cause of morbidity and mortality resulting from diarrhea. Norovirus. Where do you hear about people getting norovirus? On a cruise? While eating all that wonderful food? I went on a cruise once, but all of that food, it was just so much, it turned me off. That was before I knew about norovirus. It's the most common viral cause of foodborne disease in the United States. Fecal oral transmission or via contamination of food and water. Low infectious dose, 1 to 20 viruses. And many outbreaks are associated with what? Cruise ships. What would you think would be a reason why it's associated with cruise ships? I mean, the food is there. Some ships 24/7. Do you think that they really take it down and put it back in the refrigerator at the right times? Yes. Right. It might be dropping off some little microbes on the part that I'm fixing to eat. Yeah. So some of these, if you had to say some bacterial causes of acute diarrhea, what would you say? Salmonella, Shigella, E. coli, Campylobacter, Clostridium, Vibrio cholerae, Cryptosporidium rotavirus. Food poisoning, you get nausea and vomiting accompanied by diarrhea. Often companions that shared a meal suffer the same fate. Symptoms in the gut caused by preformed exotoxin. Occasionally comes from non-microbial sources such as fish, shellfish, or mushrooms. Have you seen the commercials where the people over in China are picking up the dead fish and shipping them to the United States? I mean, dead fish that just washed up on the shore. Not like they were out there catching fish. These was just dead fish, so let's send them over here. Now, people say that about tilapia, and they say that about, the new, I call it the new catfish, the swai, S-W-A-I. Have you eaten some swai fish? Or S-W-A-I, however you like to pronounce it, swai. Staphylococcus aureus exotoxin. So now we said that both of those main causes of dental caries were Streptococcus mutans and Streptococcus sabrinus. But we also have Staphylococcus aureus exotoxins, which are associated with custards, sauces, cream pastries, processed meats, chicken salad, or ham. I'm not bragging on myself, but I make the best chicken salad. I cut up apples in it. It keeps it fresh. You can keep it in the refrigerator a week or two. Apples. Oh no, I don't cut them up fine. I want you to know you eat an apple. All right, the onset of this exotoxin is within 1 to 6 hours, and the recovery is within 24 hours. Self-limiting antibiotics are not warranted. Bacillus cereus exotoxin. More about diarrhea. More about E. coli, enteroaggregated E. coli. It adheres to human cells in aggregates rather than in single cells. The transmission is through food and water. Cyclosporus cyantensis, Giardia. Somebody in here has Giardiasis as your disease you're looking up for your morbidity and mortality report. It's a pathogenic flagellated protozoan. So if it's flagellated, that just means it has flagella. Flagella helps it to move, makes it motile. Signs and symptoms: diarrhea of long duration, complex epidemiological pattern. It's isolated from beavers, cattle, coyotes, cats, and human carriers. The cysts from it survive for up to 2 months in the environment. Then here is entamoeba. It exists in intestinal and extraintestinal forms. Targets the cecum, appendix, colon, rectum. Actively penetrates deeper layers of mucosa. You have dysentery, abdominal pain. It can lead to hemorrhage, perforation. What is perforation? It means it's going to perforate. Do what? Put a hole in. What does perforate mean? Put a hole in your intestine. Hepatitis. It's an inflammatory disease of the what? Liver. Necrosis of hepatocytes. Response by mononuclear white blood cells that swells and disrupts the liver architecture. Interferes with the excretion of bile pigments. Where does bile come from? The liver. B-I-L-E, not B-O-W-E-L. And it causes bilirubin to accumulate in blood and tissues that causes jaundice. What is jaundice? Sometimes babies are born with jaundice. How do they look? Kind of yellow. All right, so we have the hepatitis A virus where immunizations are available. Hepatitis B virus is an envelope DNA virus. And it is especially important that healthcare workers receive this vaccine. Miss, have you had a hepatitis B virus vaccine? Is that a condition of your employment? Hepatitis C is a silent epidemic. 3.5 million Americans infected. I know you've seen that Hep C commercial on TV. Tooth decay is the most common infectious disease of human beings. Gastritis and gastric ulcers result from stress and eating spicy food. Is that true? False. What was number one? Was number one true or false? How about number three? In order for disease to result, an individual has to ingest a high number of salmonella. What was the infectious dose of salmonella? Just a few little microbes? Ground beef is more dangerous than steaks or other cuts of meat for the transmission of E. coli. True or false? Gastrointestinal tract diseases can be also caused by helminths. What's a helminth? General clinical considerations. Eosinophilia. There is a commercial on TV right now about some drug that will but decrease your number of eosinophils. Here are the larvae, the infective larvae. There's the egg in the larva, and then it's in your body, and the worms mature in your intestine. The eggs are released with feces. The larvae hatch and develop in the environment. The infection occurs through skin penetration by larvae, like hookworms. Ooh, look at that one. That's a giant intestinal roundworm. Do you think one of these could be pulled out of you? You're not saying anything, Muslim. Here's a tapeworm. Cystic cirrhosis. Fasciola hepatica. It's a liver fluke, common in sheep, cattle, goats, and other mammals. If you have liver disease, schistosomiasis, and another one is S. japonicum, it's morphologically and geographically distinct, has similar life cycles. It can invade transmission methods and disease manifestations. It can invade intact skin. So how does it invade intact skin? Hookworms infect humans through life cycle. Okay. The infectious diseases affecting the gastrointestinal tract. Helminths, bacteria, viruses, and protozoa. All right.